रहीम अस्सलाम वालेकुम एवरीवन। आज का हमारा टॉपिक है नीड असेसमेंट। नीड असेसमेंट में हम लोग अपने ऑब्जेक्टिव्स गोल्स देखेंगे। ऑब्जेक्टिव्स डेवलप अ फ्रेमवर्क टू असेस द लर्निंग नीड्स, हेल्थ प्रॉब्लम्स ऑफ अ टारगेट ग्रुप, एनालाइज द प्रॉब्लम्स अकॉर्डिंग टू द प्रायोरिटी। Introduction. Learning needs assessment as a fundamental role in education and training. In his descriptions of adult learning, Knowles assumed he did not claim to have research evidence that learners needs to feel a necessity to learn and that identifying one's own learning needs was an essential part of self-directed learning. Importance. Learning needs assessment is a crucial stage in the educational process that leads to change in practice and has become part of government policy for continuing professional development. It might be help to curriculum planning, diagnose individual problems, assess student learning, demonstrate accountability, improve practice and safety, or offer individual feedback and educational intervention. Importance. Needs assessment represent one of the first steps in planning and developing extension programs. Program planning and development is an ongoing and interrelated process that in addition to assessing client needs includes selecting appropriate content and methods in program delivery, managing program delivery and evaluating program process and outcomes. Definition. What is need assessment? Need assessment is defined as determining if gap exists between what is and what should be in terms of the outcomes of extension programs and then determining the priority of these needs. Kaufman 1982. Emphasis will be placed on making decisions and setting priorities based on information gathered from the people likely to be affected population. Difference between needs, wants, and interest. When needs are being determined, it is essential that distinctions are made between needs, wants, and interest. Needs refer to something considered necessary or required to accomplish a purpose. Wants, on the other hand, are considered desirable or useful but not essential. Interest indicate an individual's concern or curiosity about something. Need assessment classifications. Classifications include felt needs, express needs, normative needs, comparative needs. Learning needs assessment divided into two groups and individual. And individual also divided into self and others. Individual. Self-assessment by feeling. Self-assessment by diaries, journals, logbook, weekly reviews. Reflection on action and reflection in action. Peer review. And individual others. Individual techniques include face-to-face interviews, key information interviews, questionnaire, informal personal observations, and formal personal observations. Individual techniques involve collecting data from people one at a time. The people from whom the needs assessment data are collected do not interact with one another in the course of providing data. Target group. The group people that a policy or campaign is hoping to influence in some way. For example, class-specific community, childbearing women, school-age children, young children. These are models. Assessment models is health indicators, key information model, detailed interview, social indicator model, monitor social change, community forum model, public meeting, gathering, survey model, critical incidence model, incidents that cause great change or discomfort, hybrid model. Assessment tools, observation, surveys, standard, interview, newspaper or literature review, government or health institute records. Process. Data gathering, analyzes the data, define learning needs, prioritize to be learned, decision about techniques, choose best one technique, implement feedback. Assessment phases. There are three types of assessment phases: before assessment, ongoing assessment, post assessment. Before assessment is community engagement, input collection, realistic expectations, transparent communication, accountability resources, and ongoing assessment that data gathering, analyzes the data, set prioritize. And the post assessment is feedback, review, evaluate the program. Learning needs assessment. Center from Human Rights Education. This type of evaluation is conducted before developing a training event to ensure that the training meets the needs of participants, verify our assumptions, regarding the participants' needs, perceptions, and attitudes towards learning. Make the best use of resources available: time, people, facilities, materials. We need to know target audience demographic information, previous knowledge, skills, and attitudes, the human right context in which the training event will take place, the gaps in knowledge, skills, and attitudes that you want to bridge. Our set priorities. We have the discretion to develop priority setting criteria and process, the magnitude of the problem or asset, severity of the problem, community's capacity and willingness to act on the issue, ability to have a measurable impact on the issue, availability of hospital and community resources, existing interventions focus on the issue, whether the issue is a root cause of other problems, the priority the community places on the problems. Additional priority setting criteria in the needs assessment: evidence that an intervention can change the problem, alignment with an organization's existing priorities, including equity of care, the hospital ability to contribute resources and expertise to address the prioritized area, potential challenges or barriers to addressing the needs, the opportunity to intervene upstream at the prevention level. Thanks for attention.